us are apprehensive and worried. So basically such sessions will help us. So all these days we had some external motivating factors, be it your surgeon or nutritionist or your fitness trainers, or listening to music would motivate you. All these motivating factors have come to a standstill right now. So this is not the end of it. So when it comes to weight loss, as sir said, it is a risk to carry a huge body, especially obesity is a major risk factor for this pandemic. So during this season, we should not increase and worsen our situation. Rather, we should prevent ourselves, make sure we don't put on weight and don't come up with diseases such as diabetes, heart disease, and so on. As I see, people are indoors, they are not exercising, they are just sitting before the television, just working from home. Sitting hours are increasing, and there is lack of interest when it comes to cooking healthy food. So all are busy looking at the COVID numbers, just like how you watch out the cricket scores. So what I would suggest is, at this time, just watch out few tips I have for you today. So what motivating factor that we can look at? So there is one thing I would want to share with you all, what motivated me to lose 10 kilos of weight recently. So I would want to keep this before you at this moment. It can really help you during this season and after this as well. So one thing you should remember your critics. So the ones who criticized you, the ones who said you can never lose weight, what have you made to yourself? Remember those people who have criticized you, given a list of things, spoken list of things against you, against your weight, against your body shape. So think of all of them, make a collage of them, put it on your screensaver, and just look at them every time, and then you just get motivated by that. So that can be your strongest motivating factor at this moment. I encourage each and every one of you not to lose hope. Just get started with your exercise and your healthy nutrition regime so that you don't miss out on your regular healthy eating habits. So coming to how do you achieve success in your weight loss. So for most of our bariatric patients, we have given them nutrition care plan. With our surgeon, we have prepared these plans. So we would want you to continue the same plan, and there is till the world ends, you have to keep continuing. You should not stop this. If you need any help, you can come for regular follow-ups. For your convenience, now we have telemedicine services, so please come and visit us. So when it comes to your exercise, you should get going. There shouldn't be breaks for exercise. And your immunity, to boost your immunity, I will be talking about this in detail later. So compliance to the supplements, basically whatever supplements have been prescribed by your doctor, especially the protein supplements, vitamin, mineral supplements. So you should continue the same. So this will really help you at this time of pandemic. So self-monitoring. So some of our patients do maintain a food record, a food diary, in fact, wherein they keep a track of what they eat and how much they exercise. When you come and see us, or when you come on a telemedicine call, we would expect you to let us know about all this. This will help your doctor or a nutritionist to plan and devise a nutrition care plan better. So try to maintain this at least 1 week prior to your appointment, and then be a smart grocery shopper. So take off the list of unhealthy food from your grocery shopping list. So I encourage you that, when you get this home, that's when we go and check out the shelves outside, grocery shelf, most of it is like empty. There's panic buying, what we see. So I recommend you not to stack all these at home, rather make healthy snacks at home, and that would be more encouraging. And about the snack type and what you're supposed to eat, I'll be talking about this in detail today. So get a plan for yourself from your nutritionist, because the plan which was prescribed earlier for a different situation, now the scenario is different. Most of us are working from home. We can make homemade preparations easily, which is available. So accordingly, you need to revise your plan. So I have made 7 mantras for you, like how recently our Prime Minister gave us 7 guidelines. So it'll be easy for you to remember during this COVID lockdown. Remember these 7 things that you should not forget. So the first tip is that keep a close watch over your fat percentage and your waistline. So when it comes to your waistline, there is cutoff values. 80 is for women and 90 is for men. So for women, the fat percentage cutoff is actually more when compared to men. So I'm sure most of you have checked your body composition. All of you are aware of your fat percentage, muscle mass. So this you need to recheck every 3 months once. At Aster, we have 4 different types of body composition tests that we do. We have bioelectrical impedance, wherein we check through electrodes, through infrared rays. We have a DEXA, we have skin fold thickness. We have various types of assessments at one place here. So you can get yourself checked once you're permitted to come and visit. So greater body fat percentage poses more risk. So do not just chase your weight. So weight is just a number. It is a primitive method of assessing. So now the latest one is to check your body composition, to understand your muscle mass and your strength. So get a hand grip strength checked. So when you meet your nutritionist, all these tests needs to be done before they devise a nutrition plan for you. So we also understand that most of our post-bariatric patients, when they visit us, they would have lost weight. So most of you have lost weight. Most of you are looking lean. You might be feeling that my BMI seems normal and fine. What we have recently observed, people who look lean, people who have normal BMI can also have more body fat percentage, and they look lean, but still these composition varies. So keep a watch on this. Yeah. So the next one is exercise. So do not stop exercising. Exercise boosts your immunity. It preserves your lean body mass, that is your muscle. Muscle is the greatest asset one can have throughout your life. So build up your muscle so that you have good strength. You're not prone to infection. You can withstand any kind of high intensity exercise in future. So there should be a balance between your workout. There should be a balance in terms of cardio workout and your strength training. Not just walking will do. You should also look at strength training exercises. So next week we'll be having a demo of a cardio session, but still strength and cardio both will help you. So home workouts are more popular nowadays. So you can also have some fitness challenges arranged if you're part of any WhatsApp group. So get you can initiate a fitness challenge within the group, and that would be more exciting, and it can motivate you to get going with your exercise. So purposeful movement, going for a grocery store and your household chores, we all are involved in these, but that should not be a replacement for your exercise. You should make sure at least 20 minutes to half an hour of exercise is done along with all these activities that you do. So if you're sitting in one place for a longer period of time, within 1-2 hours, you just take a break of 5-10 minutes and come back and continue your work. So we all are aware of exercise and its benefits. So check with a physiotherapist what exercise suits you so that you can, get started with that. So coming to the third point, that is adequate hydration during the summer, especially during this flu season, disease outbreak. And if you've been exercising regularly, you tend to lose more water. So there are various ways, not only water, you can take fruit infused water, immune boosting drinks. I have some recipe ideas for you at the end of the session. So you can look at that and start using them, including them in your daily diet. So caffeinated drinks, we all know caffeine flushes out more water from your body. Keep them, just limit them 2 cups every day. Do not overdo. And when it comes to green tea, most of us think it is caffeine free, but it do contain some amount of caffeine, so watch out them. And keep sipping water throughout the day. When we wear our masks, especially, we tend to forget to drink water. So make sure you are hydrated throughout the day. Yes. Coming to protein first, but it is one of my favorite nutrients among all. Why I have mentioned it as protein first? It's because protein first means you start your meal with protein and end with carbs. So what we generally do, we start our meal with rice and we add on more rice, we add on more chapatis, and there's no end to that. So when you start your meal with protein, when you start with probably dal soup, or it could be eggs or chicken and so on, and then add some vegetables and then end with your carbs, that's when you limit your intake. You feel full by then. Protein gives you satiety, it makes you feel full, it works on your hunger hormones. So basically you feel full. That's the reason add good amount of protein in your diet. And this requirement varies. Where I've mentioned your 60 to 100, for a post-bariatric patient, we go about giving more than this. So it differs from person to person. So this should be fixed and personalized for each individual. And at least 50% of meal. So this is basically for a post-bariatric patient, we counsel saying that protein should also be given importance along with your carbs. So protein has various other functions. It also takes care of your immune system. And basically someone who has severe hair loss, we should look at their protein intake. And you can look at this table over here. So you can find the protein, 30 grams of protein rich foods, wherein if you consider how much of protein it would contain. So when most of our clients come and tell us, when we tell them your intake of protein is less, they wouldn't accept this. They would argue saying that, no, I eat dal, I eat this, but still, when you look at the quantity, 30 grams of dal, cooked dal, it gives 3 grams of protein. Eggs, most of you are fond of egg whites only. You discard the yolk, but when you see if it is white, and it is just 3 grams of protein. So you will be reducing your protein intake if you do not take it adequately. If your minimum requirement is 60, then imagine how much we all are deficit of protein. So ensure you ensure there's adequate protein in your diet. So get a personalized plan, start counting your protein. Again, it's an age-old method just to count your calories. Protein needs to be counted, your carbs needs to be counted. So this is something that you got to educate yourself and understand how to include them in your diet. So choose healthy proteins in your diet. So various sources we have been talking time and again about protein. All our pediatric patients are aware. They have mastered when it comes to protein intake. So we need not have to go in detail. So when it comes to protein supplements, so just don't prescribe it by yourself. There are various criteria involved when you prescribe protein. So check with your nutritionist. So especially the type of sweetener used in your protein powder. One serving gives how much of protein, and then PDCA score, all that is considered, the composition of it, the sodium, potassium content, so many things varies. And this composition is not same for everyone. Someone with kidney disease, it varies. Again, it has to come down. So always check with your doctor or nutritionist before you prescribe it for yourself. So the fifth point is to choose fiber. Okay. So fiber, recently we have observed, I've been hearing from my patients, most of them suffer from constipation, sitting in one place for a longer time. There's lack of exercise, there's so much of stress, mental stress, where we get infected, where we can get, if you have little symptoms of cold, fever, then you get worried about it. Stress can also increase this issue, and even lack of water intake. So with adequate fiber. Most of us are not preparing, we don't have interest in cooking, and then vegetable preparation has come down. So it is better that we add at least 3 servings of vegetables every day. 4 times in a week you should add leafy vegetables. So fiber comes from various sources, fruits and whole grains and things like that. So when it comes to whole grains, something about carbs I would want to add here. So most of our patients, when they come back, they tell us that they have been on low carb diet, zero carbs, sorry. So when it comes to zero carbs, if when you don't take carbs at all, then what does your body use for fuel, energy purpose? So for your energy requirement, your body will use the protein what you take. Breakfast you eat egg, lunch you eat some prawns or chicken, and then dinner you have dal. This will not help. Your body will use protein for the requirement of energy, and the protein will not be spared for muscle building or for the purpose of protein functions. So you should ensure, if you're not adding carbs, then the next source should be at least fat. So if you're not balancing your diet, again you will start losing muscle, and you look lean. The weight you have lost is not fat but muscle. So make sure adequate carbs are also there. So you will not be surprised if I tell you carbs are also important, because they spare protein. Not only that, they also help most of our patients who have gone on zero carb, they've come with excess hair loss. So there are certain amino acids in cereals that are required. So make sure certain amounts are taken in your diet. So even in carbs, there are 2 types: healthy carbs and unhealthy carbs. So healthy carbs would include the whole grains, especially whole wheat, sweet potato, unpolished rice. I don't know how many of you use them, millets and so on. So try and use them in your diet. But again, carbs, there is a certain amount prescribed for different people, different amount of carbs. So ensure that is also fixed for you. Then refined carbs. So what we see, dumping syndrome, most of our mini gastric bypass patients, they complain with dumping syndrome. Sir must have been hearing, he's been getting these complaints from patients, because they eat a lot of simple carbs, a lot of sugar, a lot of maida, and so on, white rice. So eating a lot of these simple carbs, which gets digested faster and releases sugar faster into your blood, they have the risk. You tend to put on more weight. Not only that, your sugars will go high. And dumping is something wherein these patients experience bloating, severe abdominal cramping, and so on. So ensure that these, when we tell you to limit refined carbs, please stick to that. So coming to fruit intake, add variety of fruits. We all are aware. So fruits, immune boosting fruits, I'll be talking about it later. So ban sugar. So when I talk about sugar, most of you must be laughing. Those who know me, I have stopped sugar a year back. So kind of I've become anti-sugar, and after that I've seen a lot of visible changes in me, and it has definitely helped me, and I'm telling you, it will help you. So try and go ahead doing this. And most of you wouldn't leave you to do that. They would tell you, we have jaggery based, we have a better option for you. So jaggery should not be replaced with sugar, because jaggery, that is meant for children. It has certain minerals, but still it does increase your sugar levels. It is not a replacement, especially for a bariatric patient. Don't go for that. So there are other, instead of artificial sweeteners, we can look at natural sweeteners. Stevia. When I talk about stevia, most of you will be wondering about the taste. So there are other variants available, better taste options available these days, so you can look for them as well. So the sixth point is fats. So fats, when you talk about fats, so there are healthy fats and bad fats. So healthy fats are the ones which you need to include them in your diet. Fats are not harmful if you use good fats. You must have heard of omega-3, PUFA rich oils. So include them in your diet. They help to prevent vitamin A, D, E, K deficiency. It improves your immunity. So good fats should be there in your diet. So we do not practice a very low fat diet anymore. Adequate fat is actually important for you. So there is a percentage of fat that we need to consider. Nuts have good fats in them. And again, most of you would ask me which oil to use. There are variety. So combination of oils is the answer for this. Why? Because each oil has different composition of omega-3, omega-6, omega-9, so on. So hence it has to be considered like a combination. For different preparation, you can use different oils. It is not this month one oil, next month another oil. So include all these oils like rice bran, coconut, sesame, or it could be olive and fish, ghee also, and oil seeds, seafood, all of them, and I've missed avocado, that can also be added. So saturated fats and trans fats, some of the bad fats, what we categorize them, they should be limited in our diet. Something like, if you consider 1 teaspoon of ghee, it gives 3 grams of saturated fat. So according to American Heart Association, it has to be less than 8%. So ensure these are taken if you're eating red meat and so on, saturated fat goes on. So this should be limited. So trans fat, especially your bakery goods, trans fat is nothing but vanaspati, what is commonly used, and packed foods, palm oil, all of these trans fats, what they do, it should be less than 1%. It has the risk for your heart disease and so on. So these fats should be limited in your diet. So these fats are very tasty and they are popular, they are economic, it is cheap, and so most of them use this. So watch out when we talk about fried packed items, when we tell you don't pick them up from your grocery store, this is the reason why we tell you. So when it comes to your oil seeds, oil seed, it could be sunflower, flax, chia, pumpkin, kalonji, variety, at least 2 teaspoons every day is the requirement. Don't overdo any of these. So now the 7th point is about immune boosting methods, immune boosting foods, wherein the first one is vitamin D. If you've been prescribed vitamin D, if you have not got yourself checked for vitamin D, please do that. Sometimes you just vitamin D helps in your immunity, and if you've been suffering from hair loss and you've been obese, so always it's ideal for you to check vitamin D and supplement yourself. If you have supplement by considering your doctor or your nutritionist advice. So quality sleep, 6 to 7 hours you got to sleep, and de-stress activities. When it comes to de-stress activities, exercise can de-stress you, and or it could be a recent Ayush guidelines recommends breathing exercise, and even it could be meditation or a massage. You'll have to do a massage for yourself because we have to maintain social distancing for next couple of months. So when it comes to immune boosting nutrients, so we've been hearing about vitamin C alone. It's not just vitamin C. There are various other ways. As Sir mentioned, there are various other ways to boost your immunity. Food is also one among them, and not just vitamin C, there are various other nutrients. So you need to bring a balance, not just by eating vitamin C rich fruits will help you. So other ways wherein overall your immunity, not to just fight against this COVID situation, it's also because we have many cholera cases coming up, we have various other diseases outbreak. So it's better that you keep your overall gut immunity and everything in place, not just now, throughout your lifetime. So ensure all these ingredients. So we Indians are blessed with such good ingredients that helps to boost our immunity. So go ahead and use them. And again, do not overdo. We see people adding a lot of cinnamon, many teaspoons of cinnamon. Remember, this is also a hepatotoxin, wherein it is harmful for your liver if you take more than recommended amounts. So ensure all of these taken in moderate amounts. So I have some recipe ideas for you, but as such directly you cannot include these immune boosting foods. Earlier times we were able to have in form of kashaya and rasam and so on, but of late children, not only children, even adults do not want to include them directly. So try and use these recipe ideas. You can take a screenshot and use them, like something like chia seeds that can be be used along with amla. Amla is rich source of vitamin C, and again, fenugreek seeds, that is a prebiotic, and then flax seeds, tomato in form of chutneys you can use. Moringa powder, this is rich in vitamin A, that is nothing but your drumstick leaves. It comes in form of powder that you can use with your buttermilk, sunflower seeds, and then ginger, garlic, as much as possible include them in your diet. And again, the spices and your green tea can be included with all of these immune boosting ingredients, and so on. So we have list of these recipe ideas wherein it can help you in adding them in your daily diet. So just don't do it on your own, because most of them at home, they could be diabetic, or someone with renal kidney disorder, or someone with some other ailment. So for children it could be different. So just consult with the expert before going ahead. So for your convenience, we have telemedicine. Sir is also available. All our doctors are there on this platform. So you can reach us out easily now. So you need not have to worry about coming to a hospital. It is much safe. You can use teleconsultation also. Okay. Thank you so much. Thanks for your patient hearing. So we can take up some questions. Sir?
Thank you, Edwina. That was a wonderful presentation. I'm sure everybody is very much benefited. There will be a lot of questions also. So whoever wants to ask questions, I think Deepa will admit them into the, to ask questions live. Okay, Deepa?
Yes, sir.
Yeah.
So I think there is one question. I think ma'am's answered that. No. The question is, I think, sir, you already answered that. No, any good protein supplement as a suggestion?
Yeah, protein supplements I have answered. Yeah.
Okay. So in case anybody has any questions, you could please raise your hand. Maybe you can chat message. I will unmute you all.
Yeah, Edwina. Hello, Edwina.
Yes, sir. Tell me, sir.
Can you tell us some of the, you spoke good vegetarian food, sorry, the proteins.
Yes.
Can you tell us which are the vegetarian good protein diet which they can take?
Yes, sir. When it comes to vegetarian, we have different categories. There are vegans. So we get patients who do not use any animal protein at all. That's a good question.
Yeah.
So animal protein, again, the best option is vegetarian protein. The best option is whey protein, the milk and milk products. The next option would go to our pulses, lentils, soya. So someone who do not want to take even milk, who are intolerant, then almond milk, or it could be soya related products, green peas, mushroom, or it could be nuts. So all these could be the best option for vegetarians.
Yeah, milk, the cow milk, a lot of people consider as animal product. So they can go to soya milk or almond milk.
Almond milk.
Okay,
So
any other milk available?
Soya products, even rice milk, but not widely available here. And even tofu, that is soya paneer, that can be used.
Right.
There is recently kefir, which is commonly available at our store, that has B12 also. So that can also be used.
Right. Almonds, any other nuts?
Almonds, walnut, hazelnut,
okay,
and peanuts.
good source of
Yes,
protein.
Brazil nut. So they are all good source of protein, omega-3, fiber, and so on. So a handful of nuts should be there in our diet.
Right.
Ma'am, there's a question. How long a person can be in a keto diet? Is it safe to follow keto diet for a long time?
So whenever people see ketogenic diet under my name, they would definitely ask me this question. So I do not recommend ketogenic diet for weight loss as such, but in case, because there are various other methods, safe methods. So for how long, if you would ask me, no, if you follow keto diet for 2 months or 3 months, again, you get back to the regular routine, then you bounce back. So you cannot cheat when you follow keto diet or intermittent fasting. So cheating is bad for these two diets. So because it involves some of the side effects like constipation, hair loss, or renal stones, and cardiac issue. But in case some patients, they themselves come and insist that I would want to follow keto diet. Keto diet is a miracle diet when it comes to other disorders like epilepsy and so on. So when it comes to weight loss, just find out other methods. There's weight loss surgery if you can't handle it. Then there are other various ways. Why to go for a keto diet? That should be the last option for you.
So, ma'am, the next question is it recommended to use any protein powder?
Yeah. So protein powder, we need to assess you, like your, as sir said, if you're a hardcore vegetarian, if you're busy and you can't include all these protein sources in your diet, and we should look at your renal parameters, and if everything is fine, going good, and if you've been exercising, you're involved in what type of exercise, heavy workout or moderate. So looking at all these parameters, we will also have to analyze which type of protein supplement suits you. So based on that, we can suggest, but it's not a general advice. We can't just tell you you can use this protein powder.
So the next question, ma'am, is can we do yoga in post-bariatric surgery?
Yeah. So yoga, sir should be answering this.
Yes.
Because
probably not initially. After 2 months, they should be able to do, they can do. And also after the weight loss, yoga is best to have a flexibility of the body. And best, you have to do muscle strengthening exercises and also cardiorespiratory. And you can add yoga to all these things. Just yoga is not sufficient, but yoga can definitely be done in post-bariatric surgery patients, probably after 2 months or so. That's okay, Edwina?
yes, sir, perfect. You're the surgeon.
So, ma'am, another question on intermittent fasting, would it be recommended?
So as I've mentioned, be it intermittent fasting or whatever, you should not cheat. Again, we have seen patients coming up with severe bloating. They go for a party and they eat heavily, and then your body is not ready to take it, and you come up with severe bloating issues. And again, you will have to keep visiting the doctor for that. So it is not recommended for. We should look at clients whom it would suit, and then we should recommend. We do recommend. We have a couple of research papers recently, but it is not meant for everyone. We should look at clients and then decide.
The next question is by Suds. She'd like to know if the MI body composition scale is reliable. Also, can we see averages of fat percentage in women for various age groups? She's 55.
Okay. So the body fat analyzer, we have, I think I've not mentioned this, DEXA is gold standard, what we have it here, but DEXA would cost more, and every time you will have to undergo the scan. So it's difficult to monitor. So electrode, the next option would be the infrared rays, through which we assess body fat and muscle. That would be the next accurate one. And if you do not have that, then for routine purpose, then for study purpose, we do not use the regular, the scale what you have mentioned, MI scale. So you can just use it for routine check, but it is not reliable. Definitely from DEXA to these tests, there is about 5%, 3 to 5% of error that is recorded according to research.
Okay, so Shailaja ma'am has raised her hand. Ma'am, I'm just unmuting you right now. If you have a question, please speak.
Yes, Shailaja.
Ma'am, you're muted. Will you please unmute?
Now there is one more question.
Yeah, I'm
Yeah.
Pratibha ma'am. Yeah, Shailaja ma'am, yes, please.
Shailaja, ಹೇಳಿ ನೀವು ಮಾತಾಡಿ.
ನಾನು ಇನ್ನು ಎಷ್ಟು ದಿನ ತನಕ ಲಿಕ್ವಿಡ್ ಡಯಟ್ ಅಲ್ಲೇ ಇರ್ಬೇಕು ಡಾಕ್ಟ್ರೆ?
ಓ ನಿಮ್ದು
1 ತಿಂಗಳಾಯ್ತು, ಮೊನ್ನೆ 16th ಗೆ 1 ತಿಂಗಳಾಯ್ತು.
ನೆಕ್ಸ್ಟ್ ವೀಕ್ ಹಾಸ್ಪಿಟಲ್ಗೆ ಬನ್ನಿ, ನಾನು ಇರ್ತೀನಿ ಮಂಡೆಯಿಂದ. ನೋಡ್ಬಿಟ್ಟು ಚೆಕ್ ಮಾಡ್ಬಿಟ್ಟು ಆಮೇಲೆ ಡಿಸೈಡ್ ಮಾಡೋಣ.
ಓಕೆ ಸರಿ, ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್.
ರೈಟ್.
Pratibha ma'am also has a question. Ma'am, I'm unmuting you. Please speak.
Hi, Edwina.
Hi, Pratibha.
Yeah, I just want to know what is the best way to start your day. You know, some dietitians recommend for you to drink jeera water as soon as you wake up, and some dietitians recommend you drink lemon water with the honey. So I just want to know what is the best way to kickstart your day, like a cleansing drink after you wake up.
Okay. So any herbal drinks would be fine. Just plain lemon water is not necessary. If someone who has severe gastritis with excess spices added or excess lemon added, you would trigger it. But as such, you can take other herbal.
Yeah, Edwina, for the post-bariatric patients, I think best is to start with whey protein in the morning.